Welcome back, ladies and gentlemen, to Aesther Healthcare Acquisition Corp's a channel with an agreement to merge with Ocean Biomedical. Joining, we have the privilege of Surin, the Chief Executive Officer of Aesther, who's going to give us an idea of this merger, and Chiranjeev, the CEO of Ocean Biomedical, who's going to give us some insight into the pipeline that's going on there. So first and foremost, welcome to both of you, and I want to kick it off with Chiranjeev on the novel malaria drug discovery presented at the ASTMH Tropical Medicine meeting with the co-founder, Dr. Jake Curtis, unveiling this new class of anti-malarial drug. Do you want to give us an idea of what's going on under the hood there at Ocean Biomedical?
Sure. I think it's really good to understand how severe malaria is. People may not understand that malaria caused by Plasmodium parasite is really the greatest single agent killer of children on the planet, bar none. Almost 627,000 individuals last year. The current treatment of artemisinin-based drug therapy is still the mainstay, but now because of resistance, it's causing a serious problem. Dr. Jake Curtis, who's the head of the MD PhD program at Brown University and the scientific co-founder of Ocean Biomedical, has discovered a parasite protein called PFGAR, which targets human antibodies, which can kill up to 100% of the parasites in vitro by inducing apoptosis, which for just so everyone knows, that's programmed cell death. And this discovery really forms the basis of Ocean's Biomedical, lipid encapsulated mRNA vaccine and the new, novel class of anti-malarial drugs.
I appreciate those insights. And I want to kind of ask Surin here, what does this acquisition and this merger with Ocean Biomedical look like?
Thank you for organizing this, Kyle. Thanks for joining, Chiranjeev. The main reason why we are interested in this, as you're aware, Aesther Healthcare, is we want to bring in the future technologies that are into the market, untapped or unidentified. And that's what Chiranjeev and teams bring. Their portfolio includes like oncology, fibrosis, and infectious diseases like malaria, as Chiranjeev mentioned. And most of the stuff you find in the market are a cure, and these guys bringing the technology almost ready to be cured. That's the reason we have entered into the agreement. And we are paying an equity valuation of $240 million. If all 100 million stays, total valuation will be around 345 million equity valuation enterprise value. And we even brought in up to $80 million worth of backstop and a $75 million worth of ELOC. So it will be well-funded company so that these guys can file the INDs that are necessary to bring in these clinical studies to market. As Chiranjeev says, that bench to bedside kind of a accelerated growth plan for their molecules.
I really appreciate it. Go ahead, Chiranjeev.
So I was just going to further add what Surin was saying. So, the company has 3 platforms: oncology, fibrosis, and infectious diseases. I think one of the biggest discoveries was the bispecific antibodies that target chitinase 3-like 1, which is the master checkpoint immune inhibitor. Just so people realize the novel or the immense impact, that has demonstrated it can kill glioblastoma cells and melanoma cells, blocking the metastasis in the lung by over 90%. Just to give you an idea, glioblastoma or brain cancer is a deadly brain tumor. The 5-year survival is just 8% for those aged 45 to 54. And 25% of the patients don't even get treatment because of rapid progression of disease. Senator McCain, was, an unfortunate example. And if you take non-small lung cell, cancer, that is the leading cause of cancer death. And what kills you is the metastasis. So Dr. Jack Elias, who's Ocean's scientific co-founder, a professor at Brown University, and the former dean of medicine at Brown University, and the former chairman of Yale's Department of Medicine, discovered it. And studies from his laboratory have identified that chitinase like 3-like-1 is a critical regulator of number of the key cancer-causing pathways. In fact, we believe it's the master regulator, the master checkpoint immune inhibitor. And working with PD-1 and CTLA-4 pathways, it's shown that 90% of killing of the glioblastoma cells. So that is, a major discovery and could impact, hundreds of thousands, just in the US, 450,000 people just get, non-small cell lung cancer. And the other thing is almost 129 million of grants and ongoing grants have gone to develop these platform assets over the last, 2 decades.
I definitely appreciate these insights, and I want to pass the question off to the viewers here. We'd love to know what you guys think about this in that comment section below. Consider subscribing, because as this merger continues to push forward, we're obviously going to update you as the news comes down the wire. But on that, stay cool, stay awesome, and as always, we look forward to catching you in the next one.